Hello, friends. My name is Mary Del Hayes. I'm here with you today from the Together SC team. You'll see our amazing executive director, Madeline McGee, in the chat and waving her hands at everybody to say hello. We are so excited to be here with you. We've got an amazing program from Hannah Moore with Willis HR, who is here to walk us through the updated COVID guidance. Of course, I would be remiss not to give you the Together SC commercial before we get started. And so here it is, the Together SC commercial. We are really excited to have the most amazing opportunities for you to connect and learn with your peers and colleagues across the state coming up in the next couple of months. And we have a lot of opportunities that we think will really help you to achieve your mission. So we hope that you are going to be joining us in March 9th through 11th for the annual Together SC Summit. You can go to our website and learn more about the summit. We've got amazing tracks available for you to really dig deep into issues related to operations, development, volunteer administration, all of the things that have been shifted on their head due to COVID. We've got a great equity track. We've got a Black nonprofit leaders track. There is something for everyone there. And so we really, really hope to see you. And we encourage you to register today because those spots are filling up fast and they are not going to save. The other part I would encourage you to learn about and to connect with is one, to make sure your member Compass records are up to date. If we don't know who you and your staff are, we can't provide you with the best possible information, and that's just a tragedy. So please log on to Member Compass today. Make sure your records are up to date so that we can connect with you and your team. And also so that you and your team can get invited to join our peer networks. We've got great opportunities for folks to connect as a benefit of membership across a variety of fields and specializations appropriate for anybody in your team who can probably find a role to get some really beneficial support in these challenging times. And so again, please make sure your information's up to date in Member Compass and check out our peer networks. The next two things are the two things that we are probably most excited about. We are launching an association health plan. What? Yes, it's true. You may be getting your health insurance in an association health plan with Together SC. So make sure you check out our learning calendar, which I'm sure Madeline's about to drop the link in the chat so you can access all of these amazing opportunities. Learn more about the association health plan later this month. We've got a webinar just for you. And then to stack on that, because we know that I'm sure one of the things Hannah is going to talk about is the great resignation, the big quit. I don't know what we're calling it. But it's hard working in HR these days, and we're gonna be really grateful for the support Hannah provides us from Willis HR again. But we're also going to be launching a compensation and benefits study. So stay tuned for more information. We plan to have a full report out in May to help you design your compensation and benefits going into the new fiscal year. So there's lots of stuff going on in Together SC. We hope you are seeing the value in your membership more than ever. If you have any questions, comments, concerns, things you want to talk about, things you'd like to connect with, we're all here to support you. We've got Ben Bullock, our COO, Debbie Nelson, our CLO, and Madeline, our executive director, all on here, ready to connect with you, ready to provide you with the support you need. And of course, I'm also available to answer any questions you have. And with that, I am so excited to stop the commercial and turn it over to Hannah. Welcome, Hannah. I'm going to let you introduce yourself and tell us a little bit about how you got here, because I know that you have a much better way of telling your story than I can tell it for you. And we're so excited to have you here. I will be moderating the chat and looking for questions. We're going to let Hannah go through her presentation, and then we will open it up for questions at the end. So hold your questions till the end, please. But do write them down because we don't want you to forget them. And with that, I am going to stop talking.
Thank you so much, Mary. I'm really excited to be here today on behalf of Willis HR. We live COVID in and out every day, so it's great to share our knowledge and kind of help small businesses and nonprofits navigate through these difficult times. So I am the HR project manager for the team at Willis HR. I've been in HR going on, gosh, this is a little over 10 years now. So I've mainly been involved with smaller businesses and a couple of nonprofits through Willis HR as well. So it's really exciting to be here. And I'm going to share my screen here so we can go through the presentation. So Mary, am I able to share that from here? I don't see a button for that. Let's see. Here we go. It's condensed. All right. There we go. All right. So yeah, with this presentation today, like Mary said, I'm going to be going through most of the information regarding workplace vaccinations, leave policies, and then at the end, if there's anything that I haven't covered, we're going to go through some questions as well. Like I said, we're Willis HR. We are based out of Columbia, and a lot of our day-to-day is helping small businesses, nonprofits, such as yourself, navigate through people challenges by, mainly by building HR infrastructure, ensuring compliance, and reducing legal risk. And so like I said, we're very happy to be here today to present to you, and hopefully you'll be able to take away some valuable information to incorporate with your business practices. So I'm going to start out first with kind of like the basics. So I know a lot of people have asked about implementing mandatory vaccination policy. Should we, shouldn't we, what do we need to be aware of? But I always kind of like to take it back to the basics and kind of talk about, why we need to have COVID plans and other policies in place. So regardless of whether you're going to mandate vaccines or not for your workforce, at the very minimum, you should have a COVID-19 response plan in place. And so this is a documented plan that will explain how you're handling disease prevention, protocol for exposures, positive cases in the workforce. And so you might be asking, well, why do I need to have this, in place? Why do I have to have it in writing? Here we are in 2022, and we've been living through this. And, it's not too late to have something like this in place. But for those that are not familiar with OSHA, or if you don't have to deal with OSHA on a regular basis, maybe your industry does not require any type of record keeping. But there is a general duty clause that exists that pretty much applies to all employers with very few exceptions. So this clause is intended to give OSHA the means to address hazards that may not be necessarily in the books. So when it comes to COVID, they do expect employers to take reasonable measures to protect workers in the workplace from exposure to COVID-19. And so that typically would be your hygiene protocol, sanitation, and then how you're handling, the exposures. And then employers that fail to comply with these guidelines, along with the CDC's recommendations, are just at higher risk for these type of citations from OSHA. And so kind of breaking down the general duty clause before they can actually issue a citation, several conditions must be met or satisfied. So there has to be a hazard. The hazard must be recognized. It would likely cause serious injury, harm, or death, and it must be correctable. So, at this stage, we know that there's clearly a hazard that can cause serious harm or death. And while it's not completely correctable within our control, there are steps that we can take, as small businesses to ensure that our workplaces are safer. And just as a side note too, with OSHA inspections, those are typically lodged by employee complaints. So if there really is an unsafe environment that would potentially cause the mass spread of COVID-19, that could cause, a lodge and an inspection from OSHA. And so when putting together your response plan, there are just certain, components that you'll want to have, which we'll go over here. And it's not a comprehensive list, but it's rather just kind of a framework which would help small businesses kind kind of have the framework and work from that. And so we start with the site assessment. So if you have multiple sites, you will want to do this for each location. But this is just some of the questions you may ask, when performing your site assessment. So, who at your site or sites has regular contact with others, who's working side by side closely, who's within 6 feet. And then are there any measures that we can implement that would, promote social distancing? So if it's somebody that's maybe working in a co-op space, we'll just make sure that they're distanced further, maybe put them in another location. And then for those that deal with outside customers or vendors, how can we limit access to our workplace? Can we put anything in place to where we don't have to have that constant physical contact? And then just making a note of who shares equipment, who touches common surfaces, and then identifying who might be part of a high-risk population. So that would be those that have severe immune disorders, or maybe the elderly, maybe just keeping a mental note of who those people might be. So if we do have to make any type of logistical changes within the office space, we could do that. And then also just identifying which positions could work remotely. And then also just implementing basic infection prevention measures. So this is kind of taking us back to 2020, when all of this first started happening, and really kind of promoting internally within your organization, like make sure you're washing hands, wearing masks, social distancing, if possible, stagger work shifts to where everybody's not in the same location at once. Same thing with the workspaces that are shared, and then canceling any unnecessary travel or incoming visitors. And then also just, can we support work remotely? Do we have employees that would be eligible to do so? If so, consider having a remote work policy in place. And we will go over that towards the end of the presentation on best practices with that. Hold meetings virtually. I know that's obviously been one of the biggest changes with the pandemic, is having, instead of face-to-face, utilizing Zoom and Google Meet, and, really helping with the spread of the virus. And then requiring sick employees to stay home, provide your staff with needed supplies, hand sanitizer, masks, and then implementing some sort of routine cleaning that may be outside of the norm. So depending on how many people are at your work site, you may want to increase the how often this is performed, either on a weekly or bi-weekly basis. And then, of course, identify the hot spots. So like your copy machines, your phones, door handles, make sure those are getting wiped down more frequently. And then just discouraging sharing work equipment if possible. That's also been a very big helpful measure. And then just touching on the mask mandates really quick. I know that always kind of comes up with, it may not necessarily be something that's in place locally, but implementing, in your workplace is a different matter. But as far as locally, right now, there are no mask mandates at the state level for South Carolina. Columbia has recently appealed its mask mandate as of November. However, Richland County still requires face covering in indoor public spaces, regardless of vaccination status. And so really employers should decide on whether to implement their own mandates as part of their workplace response plan for COVID-19. And then lastly, and probably most relevant right now with all the changes, establishing your protocol for workplace exposures and positive cases. So this is how your organization is going to be handling these as they happen. And unfortunately, they are a very common occurrence. And half the time I know people are like, well, what do we do? The guidance changes constantly, but we do highly recommend following the CDC's guidance on this matter and communicating that to your staff on a regular basis. So it's, with the ever-changing nature of this, it is prudent to stay, very in touch and in tune with what's going on with the guidance. I know the last guidance was issued in early January after it had changed a couple of times. So we're going to go through that guidance, kind of what we're providing to clients, but just note that it does not apply towards the healthcare industry or for those that might be severely have a severe case of COVID-19, or if you have a immune disorder. All right, so the following are just the publicized guidelines that the CDC recommends for workplace and at-home exposures. This is for close contact. That's somebody that has been exposed or has had close contact with COVID-19. So usually that's 6 feet, and then they've been around that person for 15 minutes or more over a 24-hour period. So when this person has had close contact, then they would follow these guidelines. So, and it's very dependent on vaccination status. So if the employee is up to date on their vaccinations, meaning they're fully vaccinated, they've even had their boosters, and just depending on which vaccine they've gone with, they do not have to quarantine. They can continue to work unless they develop symptoms, which they should watch for up to 10 days after close contact. And it's also recommended that they get tested 5 days after they've had close contact, and wear a mask for 10 days after the exposure. And then, of course, at any time the employee develops symptoms, they should get tested and isolate until the results are received. And then for unvaccinated, so that could be somebody that just has not gone through any series, or if they have completed just a portion, depending on which vaccine they've gone with. The guidance is a little bit different, so they cannot continue to work or come into the office. They'll have to quarantine for 5 days, wear a mask around others during the quarantine, and then test on day 5 after the exposure. And then with home exposures, I know this comes up a lot. What if my child has had close contact who's tested positive, or if somebody at their childcare facility has tested positive and they have to, shut down the classroom, or if I have somebody at home that's, has been exposed or tested positive. So in these situations, the same directives apply as the previous advice given, just depending on vaccination status. And then just depending on whether they're showing symptoms or not, they may need to quarantine for 5 days, wear a mask while in the house around the family member, get tested 5 days after exposure, and then continue to monitor symptoms 10 days after the initial exposure. And then just a note here, this does apply to employers with 15 or more employees, but the Genetic Information Non-Discrimination Act, also known as GINA, protects individuals against employment discrimination on the basis of genetic information. So essentially, this prohibits employers from asking employees medical questions about family members. And so COVID does fall in line with that. So you shouldn't be asking your employees if somebody at home has tested positive. They may reveal that information to you, but you would not want to solicit that information on your own if you're covered by this act. And then as far as positive cases, so you have somebody in the workplace that tests positive. So regardless of vaccination status, employees should stay home for 5 days and isolate, wear a mask at home if around others. And then the CDC recommends that the isolation period can be discontinued after the 5th day, as long as symptoms have resolved and they have not had a fever within 24 hours without the use of, the fever-reducing medications. And then those that have been severely ill with COVID may need to stay home longer than 5 days and should isolate for at least 10 days. So that's for those that have had severe symptoms, they're ongoing, they're not resolving. There may even be, some hospitalization. So those would require a little bit longer outside of the workplace. And then additionally, all individuals who test positive for COVID-19 need to take precautions until day 10. So this does include wearing the mask, avoiding travel, and then avoiding being around those that are at high risk. And then as far as when you're dealing with an employee who has tested positive, so there are some things you want to be mindful of when dealing with that in the workplace. So if they have a confirmed case, then any employees that they may have had close contact with need to be notified discreetly, and you should maintain 100% confidentiality with that. You can just say that, somebody that you were in close proximity with has tested positive, and then they would need to follow the exposure protocols based on the CDC guidance. And that would be based on their vaccination status. And then assign a point person within your organization to handle these types of occurrences. So if there are exposures or positive cases, have them reach out to, a very limited groups, whether that's HR or if you just have like a director of administration. So keep that, in a very close knit of individuals. And then with testing protocols, just be mindful of requiring a negative test to return to the workplace. The CDC doesn't currently recommend or even say it's required to return, just because of the availability of testing, the type of testing that's available. So like if you're requiring somebody to go get a rapid test and the only thing in their area is at a urgent care and it costs $150, that's going to be, especially if this is ongoing, could get very costly. And then, some people have been shown to test positive way long after being infectious with COVID. So just be mindful of that. And just the current guidance is just to, stay in, is basically just to stay with the quarantine guidance until their symptoms have improved. And then just additional testing resources. As of January 15th, health plans are required to pay for the at-home COVID-19 testing. And so this can be done without the direction of or involvement of their healthcare provider. And so health plans must pay for at least 8 tests per month. And so that's not only the employee, but also anybody that's on the plan, like dependents. And so just to be reimbursed, I know a lot of the companies have been kind of scrambling to get that reimbursement process in place. So typically there's going to be a reimbursement form based on your provider. So just make sure that you, if you do want to utilize this, to make sure you have the documentation. So receipt, in some cases, you may have to provide a UPC label. So just hold on to those and then just follow the directive from your insurance company on how to process the reimbursement. And then just note that they're going to want, sorry about that. They're going to want to see, an FDA approved test. So the Binax Now, Quick View, and then Entellus swab. Entellus swab is the other one that's FDA approved. And then I'm sure everybody's heard that you can order free at-home testing at covidtest.gov. So you get four free tests per household. And I know I ordered mine and within a week I got those. So that's also going to help with, testing and returning to work. Another big topic is leave management. So right now there's no federal law in place that requires employers to provide sick pay related to COVID-19. All that expired on December 31st of 2020. And so that was the FFCRA leave with the emergency paid sick leave and the emergency FMLA. So all of that has essentially gone away. I know that the employers had the option of voluntarily participating in that until September of last year. So, but as of now, all of that's expired. So it's really up to the employer's discretion on whether they're going to provide additional paid time off for quarantining or isolating during COVID. We definitely encourage companies to look at your current leave policies to make sure that they are they're not going to adversely affect those that may have to be out extra time. So it's worth considering providing some sort of extra paid leave plan for those, because I know this is going to be ongoing, and it's definitely going to be helpful for those that aren't able to work remotely as well. And if you are a company that is covered by FMLA, then you may have additional considerations to keep in mind to that effect. So if somebody's out sick, caring for themselves or a family member, dependent on whether you're eligible or not for FMLA, you might have to take that into consideration as well. And so now we're going to get into the mandatory vaccines, some of the recent information on the mandates, as well as what you can do if you are interested in implementing your own mandatory vaccination policy. So just wanted to clarify in terms of what's required, on a federal level and a state level, and then I'll just kind of go into more of like policy development. So as of right now, with the recent vaccine mandates that have been buzzing around, the OSHA ETS, which required 100 or more employees for private employers to either get vaccinated or do weekly testing, that has been struck down. So really right now, the only thing that's in place is the healthcare mandates. So I don't think that applies to any of you today. So I'm not going to go into great detail with that. But just wanted to kind of give you an idea in case there was, any questions on, well, are we or aren't we required to have a policy in place by law? So right now it's strictly up to employers whether or not they want to implement that or not at the state level. There are just a few states right now that have either implemented or in the process of implementing, laws to where it would be illegal or unlawful to ask about vaccination status or mandate vaccines. So Florida, Texas, Montana, and I believe Tennessee all have some sort of law in the books or developing right now that would prohibit that. So, and currently right now, South Carolina, they have, as of last week, introduced a bill in the House, House Bill 4848, that if it were to go into effect, would make it a misdemeanor to inquire whether a person is vaccinated or not. So this includes employers, nonprofits, businesses. I mean, it's pretty much a blanket statement. And so the violation could mean a fine of no more than $14,000 or imprisonment. So with that, it still is only in the bill stage. It's very broad, and it's more than likely going to go through some amendments. So, and it's my understanding the legislation has gone to a judiciary committee. So with that being said, it's worth keeping this in mind and watching to see what happens. One thing that was previously upheld by the Supreme Court was with vaccine mandates was, it's to protect the public and the safety of citizens. So if this were to go through, it would beg the question of how legislation like this would conflict with the with federal law. So more to come on this. I wouldn't say, if you are thinking about implementing a policy, I wouldn't necessarily allow this to deter that, but just be mindful that there could be possible future changes. So the decision to implement a mandatory vaccination policy for your organization, should really be weighed heavily. There's, employers are entitled to know about their employees' vaccination status to protect their workforce, but I think there's a lot to consider from a cultural and a morale standpoint, as well as, a logistical and, with the logistical and administrative burdens that go along with that, and then also compliance concerns. So, if you feel that alternative approaches, such as strongly encouraging your organization to be fully vaccinated versus requiring it, you may just want to release a company statement as to where your company stands on the matter, and then reassure everyone that you're doing everything to keep your organization safe and productive. So, and then you may just offer incentives for those that do choose to get fully vaccinated as an option. So, so I think with that, just have to be mindful of these concerns here, with morale, pushback from employees, and that can come from both sides. Administrative burdens, accommodations for those that may not be able to receive vaccines, and then the compliance and the record keeping components that go along with storing employee vaccination records. So let's say you've decided to move forward in mandating vaccinations. So the first step would be to kind of develop a procedure for determining everyone's vaccination status. So if you're a smaller organization, this would not be as challenging. I know for some of the larger ones, it's, it can be, a little bit challenging based on just, getting the information and what method that you are collecting this information from. So, typically you can go about a survey where they're attesting to their vaccination status. It could be direct contact where you're meeting individually, especially within smaller organizations. That would be easier to do. And then you have to decide on whether you're going to ask for proof of vaccination or not. So actually storing a copy of their vaccination card. But regardless of which method you choose, you would want to communicate why you're collecting this information, so that that there's that trust in that, so that you can move forward with implementing this. And then inquiries regarding vaccination status should be targeted in a way so that employees are not disclosing any disability related information. So this could put covered employers in violation of the Americans with Disabilities Act, or the ADA. And that does apply to employers with 15 or more employees. And so if you are getting, any type of medical related information like a vaccine card, it must be kept confidential and separate from their personnel files. And then access, should be limited to someone like an HR or, a point person, like we mentioned before. And then just other considerations. So if you are meeting with someone in person to collect their information, like their vaccination status, keep the dialogue to a minimum so that we're not going into other areas that may disclose a disability. So asking questions like, okay, well, why aren't you vaccinated? So that's a no-no. And then if you're sending a survey, just include a statement that, the employee shouldn't provide any additional information, such as medical or genetic, in response to the inquiry. It's advisable that supervisors, or at least on the frontline level, shouldn't be a part of this process. Like I said, it should be kept with a point person. And then staff should be trained in general, and this is aside from having a vaccination policy in place, but just in general, trained on not having casual conversations about vaccination status, because that could, again, lead to obtaining information that would otherwise be protected by the ADA. And then you can't mandate that employees display their vaccination status. So like on a badge or a sticker, that would be a no-no as well. And then just other general considerations, especially when requiring proof of vaccination. So just not collecting vaccination records will reduce the administrative burden of keeping this information. But if you're not collecting the proof, it could make it more challenging to ensure that they are truly vaccinated, and could make it more difficult to manage future vaccination requirements. So like, for example, if boosters do become a requirement to be fully vaccinated, which right now I don't think the CDC is saying that they are. It's highly recommended, but it's not. It is not a fully vaccinated individual. And then developing and implementing your policy. So this is just these are just important, components or considerations. It's not I would say a full list of everything, but just kind of giving you some framework. So select a deadline in which employees should be fully vaccinated by. So that should be included in your communications and within your policy. Define what it means to be fully vaccinated, including the processes of obtaining fully vaccinated status. So that's going to be, they'll be fully vaccinated 2 weeks after receiving the requisite number of doses for so-and-so vaccine, and they'll be partially vaccinated if they've only received 1 dose. So kind of spelling out basically what the CDC considers fully vaccinated, and then define how you'll be determining vaccination status. So that kind of goes back to how you're collecting proof if you are. And then if you're allowing testing as an alternative to getting vaccinated, that would take you down a whole nother rabbit hole of considerations. So you'll want to define testing requirements, what type of test, timeline, are you going to have them do it weekly? That does get kind of, in terms of the logistics component, that's where it can get difficult. So that's one thing you will want to consider. And if you are going to implement, or if you're going to allow that as an option, you will want to make sure that's clearly defined in your policies. Enforcement, what are the consequences of not following policy? You're going to have those that may refuse to do so, may refuse to wear masks. So it all goes back to policy language, and that's very important that that's included in your vaccination policy. And then recovery time, that's another thing to consider. If you are requiring employees to get vaccinated, there is that very probable chance that they're going to have side effects. So are you going to offer paid leave for that? Are they going to be required to use their already existing PTO or vacation? So it's another thing you should, should probably think through when putting the policy together. And then most importantly, just ensure that policies are being consistently applied and enforced. That's a big key with any policy, really. And then another big component to this, and it may not apply to all of you, but I just wanted to include it, would be workplace accommodations. So you're going to, like I said, you're going to have those that are going to come forward and say, well, I can't receive the vaccine because I have a medical condition, or I have a religious exemption, or I would like to propose a religious exemption. So here you would want to, both of these laws here, the American with Disabilities Act and Title VII of the Civil Rights Act, would apply to 15 or more employees. However, you may decide to implement your own accommodation policy, even if you aren't necessarily covered by these laws, just so that you can ensure that because these will come up, you need to have a process in place for dealing with them. So just keeping that in mind. And typically with that process, it's there is a formal, procedure in processing these. It's called the interactive process. So typically they'll submit a request, usually on a form, accommodation request form. The employer would evaluate, there might be supporting documentation, and then you would be able to determine if you could grant that accommodation or not, as long as it's not an undue hardship to the business. So again, that's only going to apply to certain employers, but just wanted to bring that up in case there's anybody on here that that would fall under these two laws. And then lastly, I wanted to touch on remote work arrangements. So I know that's another really big hot topic right now. It's never too late to implement one, especially as we discover more and more that we have, variants to this virus, and we're kind of going through waves here and there. So this would be just kind of best practices for implementing these policies. Again, not a complete list, but just some components you'll want to consider if you are implementing one. So you'll want to, do an assessment similar to the worksite assessment, determine, which roles are remote compatible. And, because not all will be. So you need to know, kind of going into this, which positions are going to be allowed to work from home versus not. Just determine cybersecurity risks, and then determine what other additional resources your staff might need. So if you have historically been, have not had any type of remote working capacity, you may have to implement services like Slack or Zoom so that employees can conduct meetings and stay in touch. And then also just kind of considering what employees will need at home. This is another big, thing to consider, because there's going to be things that they're going to be responsible for versus the company. So at a minimum, employees are going to need internet access, they're going to need a phone, and then they're also going to need access to, if you have a server or company file share, such as Dropbox or SharePoint. And then also access to an employment assistant program for well-being. I know that a lot of people have struggled with remote environments, and having a resource to reach out to work through that is helpful as well. So that's definitely worth considering. And then also just the essential elements of the policy. Like I said, you'll have to establish, who can work remotely. You'll want to outline what those positions are in your policy. Duration, is this temporary or permanent, or on a case-by-case basis? And then also just a revocation provision that, at any time the company could revoke the remote work policy, and everybody would be required to come back into the office. There should also be language in there referring to your company policies or your handbook. You definitely want to address confidentiality, conduct, safety, pretty much anything that applies in the physical workplace, they would still be accountable for in a remote environment. And then what their work expectations are going to be: schedules and deadlines, availability, between the hours of 8 and 5, I expect to be able to reach you, communication methods, again, like the Slack, email, phone. If they're hourly and have to log their time, ensure that they have a way that they're doing that, and they're following their company's time reporting procedures. And then performance management, and how they're going to be, how their performance is going to be measured in this new environment. And then equipment and security. Again, what does the company provide versus the employee? What are their duties and responsibilities as it comes to cybersecurity and file sharing? So you'll definitely want to include that as well. And so once you put this together, and when you roll out, communication is definitely the key, with any new policy. You may even want to tailor it to each individual so that you can accurately record schedules and outline specific expectations based on their position. Ensure that they sign an acknowledgement page, and that they're aware that you'll be holding them accountable like you would with any other company policy. All right, so I'm going to open it up for questions. I know we had a lot come through the chat, so we're going to take a look at that. In the meantime, feel free to jot down our information here, our email, our website, and our main phone number. So let's see here. Do you have quite a few?
All right, so we have given people permission to unmute yourself and ask questions. I'm going to go ahead and jump in with a question for some guidance, Hannah. So if I implement a vaccine mandate or a mask mandate in my workplace, and one of my employees doesn't respond well to that, can you give me some guidance about how to respond to their pushback?
Yeah, I mean, it's all going to go back to your policy and what the expectations are. I mean, obviously, have a conversation with them, but also be mindful of what that conversation could reveal. But at the end of the day, having a policy in place, setting the expectations, and what will happen if they do not abide by the policy will be helpful in dealing with that type of pushback. So it's more and more common, and I always say definitely have that policy in place. If you are going to enforce anything, make sure you have that in place before holding an employee accountable, essentially.
And you've talked a lot about recognizing that folks might be stuck at home because a member of their household or a child is either sick or having to quarantine as a close contact. Can an employer say, no, you can't take time off to take care of this dependent family member, you have to show up today? Or is the employer required, what accommodations again is the employer required to provide, and how much dialogue can there be between the employee and the employer when you're kind of stuck in that hard place of somebody's got to stay home with these kids or DSS is going to get called?
Yeah, it's definitely difficult, and it's one of those things where we do suggest that there is that there is more flexibility when it comes to that, especially as these variants kind of have caused waves of people being in and out. And so I would advise adopting maybe a new policy, a new COVID leave policy that would provide more flexibility. And then also just the parameters of what they're going to be responsible for doing versus not. And then also with if they are eligible to work remotely, then that would be probably the best time to consider having a remote work policy and allowing them to work from home. But again, it's going to be really a case-by-case basis of like you said, kind of talking through what their options are, and just being mindful that this is very difficult. And I think that again, having a policy, some sort of leave policy in place would help with that.
Do you have any recommendations about how to ask for proof of vaccination? What's the best way to go about that?
The most common that I have seen is a survey. So you're not having any direct dialogue with the employee, and you're just sending a confidential survey. I mean, their identity is revealed, but you're not, their responses are just coming to one person, and you're just asking what their vaccination status is, if it's fully vaccinated, partially vaccinated, I'm not vaccinated but plan to be. So you can kind of give a few options, but that would be probably the easiest way without having a whole lot of conversation involved.
And most nonprofits have volunteers in some capacity, whether it's volunteer board members or volunteers who help shelve books at the library or distribute Meals on Wheels. So we have some degree of exposure through our volunteers who are functioning in various capacities throughout our organizations. Do those same guidelines apply, and do nonprofits have particular risk areas or areas of exposure in thinking about implementing a vaccine or mask mandate for volunteers?
For volunteers, I mean, I would say, whatever you're implementing for your staff, and depending on how much contact staff is having with volunteers, you could definitely implement something similar. If they want to be a volunteer of the organization, they're going to have to adhere to, these standards. So essentially, with I'm sure there's a few exceptions, but I would say having a, probably some sort of volunteer guidelines or policies in place related to COVID would be prudent.
And can a nonprofit require proof of vaccine from anyone entering their facility? So for employees, for volunteers, and for clients, can you also require clients to have to show their vaccination status before entering your facility or your business?
That's a good question. So yeah, I think obviously you're going to want to be mindful of any state laws. I think that, the employee component, that is something that you can control, but you're going to have to realize that with other outside vendors, it's going to be more and more difficult to try to obtain that information. Kind of similar to the cruise industry right now, where they're requiring vaccinations to come aboard. You just have to have very specific guidelines implemented, and just be mindful of local law, like I mentioned earlier with that bill that's in the House right now in South Carolina. But obviously we won't know more on that but until future dates, but just keeping that in mind when requiring that from outside individuals or vendors.
All right, here's another one. So if an organization doesn't have a mandatory vaccine policy, but they also hear that an employee reports that they have been exposed or has tested positive, can they ask about the person's vaccine status in determining their return to work plan or how they proceed with that employee?
Yeah, so this kind of goes back to having a point person handle all of this, preferably somebody in HR. But I think that's you can ask. An employer does have the right to ask in order to protect their work environment. So if you're not requiring vaccinations, but you're trying to handle exposures based on vaccination status, just make sure that you're keeping that point person as their main contact and not revealing that information to anybody outside of that small circle.
Well, we've got about 5 minutes left. I'm going to keep the chat open. Feel free to come ask any more questions as we're wrapping up. So in summary, Hannah, it sounds like we need to really be consistent, be thoughtful in our implementation, have a written policy, and work with somebody like Willis HR to make sure the policies that we're implementing are as good as they possibly can be. And how great to have somebody like you who can, hold our hands and walk us through making some of these hard decisions, and especially navigating the part that's a bit more unpredictable, which is the actual face-to-face interaction with your employees when they may feel highly emotional or heated about some of the things that we're implementing. I'm not seeing any more questions come in. Debbie, I hate to put you on the spot, but I also love to put you on the spot. Would you like to jump in and do a brief advertisement for this summit as we wrap up? And then Hannah, before we hand it over to Debbie, do you want to do one more plug for Willis HR?
And I do have one question.
Yes, go ahead.
Thanks. I'm sorry. I wasn't sure I could type fast enough. So we have told our staff in counting the 5 days is that if you get your test results on a Monday, day one is Tuesday, Wednesday, Thursday, Friday, Saturday, and then you could come back to work on Monday. Is it okay that we've told people how to start counting 5 full days?
Yes, you can. Based on the CDC guidance, it's fine to tell them that that's the process to follow. Yeah.
Okay, great. And then my other question is, you had mentioned about, can we ask for a test before they return to work if we're willing to pay for it? We as the organization?
Yeah, you can definitely ask for a test. Just be mindful of obviously time frame and also costs, but it's okay to ask for a negative test upon return, but making it a requirement again can impose a little bit of difficulty based on availability of testing and things like that. So
okay, thank you.
You're welcome.
Great question.
Oh wait, yes. Oh, sorry, we have one more.
Hearing no further questions, Hannah, can you give us a closing plug, and then we will turn it over to Debbie?
Absolutely. Well, thank you. Yes, thank you so much for joining today. We're here to help with these types of issues. Like I said, we live it day in and day out. So, and we understand the challenges. And so please feel free to reach out if you are, if there's any questions or any issues that you're having, we're happy to help. And I hope everybody stays safe, and thank you so much.
Thank
So
you, Hannah.
speaking of staying safe, this is Debbie Nelson, and we have our summit coming up in person, March 9th, 10th, and 11th in Spartanburg. And hopefully Hannah's going to give us a thumbs up here, but we are asking that everyone that come to the summit have have their vaccine in place. And we will be asking for verification of that. Thanks for the thumbs up. We will also have masks, and we will have the N95 masks available to all of you that attend. So we are staying safe. We are also, because of this, limiting the number of folks that can attend this year, because we're trying to also keep some distance. And so it is filling up quickly. So I hope all of you that are on the call today are very familiar with our website and can go and view what's going on at the summit. We are particularly looking for people that are interested in our peer networks on the 10th and 11th. So you can still register for that. Our CEO forum for Wednesday actually is full. We have a limited number of folks. It was very popular and it is full, though we do have spaces available for you on the 10th and 11th during our peer network forums component. It's our 25th anniversary, so we're going to be celebrating in Spartanburg. We have all kinds of things planned, some great keynotes, and it's just all coming together. So we hope to see you in March in Spartanburg with your mask. So thank you very much, Hannah. This has been really informative, and just looking forward to seeing all of you in a month.
All right. We again thank you all for being here.